All right, so fetal development. All of you should be familiar with this diagram. You've done a homework assignment on it. What we've got here is the fertilized egg as it passes through the female reproductive system. So we start over here in the ovaries. You can see the glowing yellow egg here. And its first stop is along the fallopian tube. So if the fertilized, this is typically where the egg gets fertilized. So the sperm enter through the cervix, through the uterus, and they'll meet up with the egg in the fallopian tube. Now, the egg is fertilized, but this is not where its journey ends. It typically makes its way to the uterus. Every once in a while, you will get an egg that will implant in a fallopian tube, and that's very, very dangerous for the baby and the mother. Actually, it usually results in death if it's not caught in time. That's known as an ectopic pregnancy. Usually when that happens, there's just no way that the baby or the mother will survive, and they need to end the pregnancy. Because what happens is, as the baby grows, the fallopian tube is very, very tiny, so it cannot hold a baby. So what would happen is there would be a rupture, and the baby would die, and the mother would probably bleed to death if she did not get proper medical attention. So usually if this happens, if they detect it early enough, they do have to terminate the pregnancy. Come on, move. There we go. All right, so then the egg will continue along to the upper uterus. This is the ideal location for a fertilized egg to implant. That's where a baby has the best chance. That's where everything is supposed to happen. Now, sometimes the egg will implant in the lower uterus, and that's fine. Baby grows just fine there. It can lead to some more complications. For example, the placenta, which is an organ, we're going to talk about it, an organ that grows inside the uterus during pregnancy, and it acts as a filter between mom and baby. But if the placenta grows and blocks the exit, then the baby can't get out, and you may need to have a cesarean. So that's another possibility. And then finally, there are times where an egg will be fertilized in one of the fallopian tubes, and it just will not implant. There's a variety of reasons for this, but it does happen where a fertilized egg will just not implant in the uterus at all, and then during the normal menstrual cycle, it is expelled with everything else. So that does happen sometimes. All right, this is just a little bit of funny. You can actually build the whole thing. So here's the placenta. It grows on the side there. There's the baby. And the umbilical cord, which joins the baby to the placenta. All right? Good question. No, there aren't any nerves typically, so it's not going to hurt the baby or hurt the mother. They don't feel it.
What is it though?
All right, so the embryo is what the baby is called from the time where it first attaches to the uterine wall to the end of the first trimester. They tend to separate pregnancy into three trimesters, or three-month periods. So from months 0 to 3 months is the first trimester, 3 to 6 months is the second trimester, 6 to 9 months is the third trimester. The placenta unites the developing embryo/fetus to the maternal uterus. An embryo grows inside the mother's uterus. It is fed by the placenta through the umbilical cord. And the uterus is a female organ for containing and nourishing the baby prior to birth. All right, so here we have a little diagram. Now, the side here on the right-hand side is kind of the placenta, but it shows all the veins and arteries from mom and baby and how it gets filtered. So you might remember some of these things from grade 8 science. The villi. If you had Ms. Wojcik, she probably told that corny joke.
Yeah.
Villi, yeah. But here you can see, so the nutrients are going through mom's bloodstream. They're getting sent over to the baby. It goes into the baby through the umbilical cord. Yum, 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 yum. And then when the baby's done with it, baby expels all of those things back through the umbilical cord. It gets absorbed into mom's body, and then mom takes care of that. Question that comes up every single class: is that poop? No, we can't think of waste, like body waste, as just being pee and poo. So when you breathe, your body is taking in oxygen, it's expelling carbon dioxide. Well, in your bloodstream, the blood is taking the oxygen to the cells throughout your body, and it's bringing the carbon dioxide back. The carbon dioxide is a waste product. Your body does not need it. Your body wants to get rid of it. So that's your body expelling some waste. Now, when we talk about waste, we automatically think poop. But no, there's not poo going through the bloodstream like that, all right? It may eventually end up in the poo, but not in the blood like that, okay? That's a very serious medical condition, and you should seek doctor's help if that happens. All right. Some dangers to fetal development. Now, we've all seen the ads. You all know that you need to be very careful. The placenta is there to try and filter, to try and prevent things from getting through, but it can't stop everything. So, for example, alcohol gets through, and it can cause FAS, or fetal alcohol syndrome, which can lead to some pretty severe learning disabilities. I have friends who work in the public system, and they've seen the whole wide range of this. They've seen kids who are just mildly affected. They've seen kids who have repeated violent outbursts. They cannot sit still, and it's traced back to this as a cause. Cigarette smoke. Cigarette smoke's another one that's really bad for babies. It constricts the mother's blood flow to the placenta and to the developing baby. The baby will grow more slowly. There's been numerous studies that have shown that babies from mothers who smoke are smaller, are more have a greater chance of being underweight, so they take longer to develop. The main developmental period for a baby, where they're putting on the most body fat and body mass and muscle mass, is in the last few weeks. So another unfortunate side effect of cigarette smoking is that it often leads to early deliveries. So not only are you making it more difficult for baby to put on that mass, but you're giving it less time to do it. Now, one of the first things that any woman should do when she thinks or finds out that she's pregnant is she should go and see her doctor, especially if she's on any sort of regular medications. Something as simple as acne medication can cause some serious developmental problems for babies. Even things like aspirin, Tylenol, Advil, they're all different medications. So you need to make sure that you're speaking with your doctor, because it can lead to some very, very serious birth defects. And then this little kid here is supposed to be sick. So little viruses and bacteria. If the embryo becomes infected, it can cause anemia, heart failure, and sometimes death. So it can be very, very serious, and a lot of people don't get it. We had a situation where we were having a little get-together, and one of our friends was kind of feeling ill and coming near a pregnant woman, and we were kind of like, that's kind of rude. Maybe you should go away. So we felt a little awkward telling the person to go away, but for the baby's safety, the baby always has to come first. So the baby begins forming internal organs early in the embryonic stage, even though they won't be used until after birth. Physical features such as arms and legs can be hard to recognize in early pregnancy, but they're there. And by baby, the baby's finest features are well developed. True.
Yeah, so it's